Hi everyone. So the common term everyone hear about is arthritis. So what is arthritis? This is a common term for old or young people also. There are so many type of arthritis, but one arthritis is inevitable for a certain age. That is old age problem. So after getting old, so many people, young people will also come and ask, my granny has knee pains or my mother has knee pains, will I get arthritis also? Or otherwise I am having knee pains, is it arthritis at my young age? Or people will ask, how do I prevent it? How do I get rid of that? Now every knee pain is not an arthritis. Arthritis is what you say is any joint, the cartilage which is worn out. So worning out of cartilage is called arthritis. That can happen with age. Inevitably, as we grow old, arthritis is inevitable, but depends upon our lifestyle activities. Those people who are active in their daily activities, they do regular walking or gym activities, stay strong enough and more flexible, the arthritis is far from we say is a very late stages they will get it. And people who don't do it, regular exercises, less walking, who are bound to home, and people who are obese, overweight, and these people will get arthritis at an early stage. At what age it differs from person to person also. So lot of factors will act at what age arthritis will get and what worsen these things also. So if you see simply, the knee is a knee joint. The cartilage is a smooth surface between the joint. It will decrease the friction between the two bones. In between there are a lot of ligaments also there. So there is some fluid, it's like a glue, it helps for less friction over gliding movements. So whenever we bend or walk, the gliding movement should be there, and it makes us less friction. So over the time the cartilage wears off. Wears off means small cartilage loss will happen. It can start with a trigger. So many people, for it's a slow process. For some people suddenly the pain starts. They will say, I never had a pain, but suddenly started after a small slip or a sprain or buckled knee. Some complaint, some trigger point will be there, like some injury also. The fresh cartilage which is waiting will go over the time. When the fresh cartilage goes, the pain will start. It won't happen immediately. The arthritic pain will start in episodes. It's like some pain-free period will be there, suddenly the pain will disappear and again the pain starts, the fresh pain. It can happen, it can alter between both legs also. The worn out pattern may not be similar for both legs, but most of the people will have the worn out, the cartilage degeneration will happen in both sides, but the most of the complaints will come with one side first. They never complain both knees together. But if you get an X-ray, most of the times the degeneration will be more on both sides, equally distributed between both legs. So, but the brain accepts only one side of the pain. Arthritis can be any forms. Osteoarthritis is the common, that is the old age. It can happen at the young age also, but because of other systemic problems, other diseases associated with, like rheumatoid arthritis or ankylosing spondylitis or septic arthritis, or previously any injury like a fracture at the joint level, we'll say traumatic arthritis because of infections. There are multiple other causes also there. Those are secondary to other reasons. This is primary. Even without anything the body has to become old, depends upon the flexibility, the arthritis can be delayed. It is not the drugs or food or something, it is your habits that can delay the process. So weight management, proper lifestyle, proper exercises, regular walking can prevent arthritis till late stage. If you don't do that, arthritis will catch up early. It's a comparison of lifestyles. When we compared 3 decades ago or 4 decades ago, like our grannies, where they are flexible at 60 and 70 and they are active, they can sit on the floor and they can get the activities done. Now if you compare the second generation, your mothers or something, because of lack of lifestyle properties, activities, these people will suffer arthritis early. So common question everyone has, how to avoid arthritis, how to be active, how I can delay that. There is impossible to avoid arthritis, but you can delay the process of arthritis, getting arthritic for your joints. Most commonly affected joint is the knee joint because it's a large joint in the body and entire weight will be there on that. So the most common. Second most common is the hip or shoulder. That's very rare unless there is other causes are there, like a post-traumatic means injury is there, or any fracture happens in the thigh bone and that's leading to arthritis in the hip area. Otherwise shoulder arthritis is very rare in Asian scenario. So but unlike in rheumatoid conditions, the hip arthritis is more common in rheumatoid or ankylosing spondylitis. Knee is very late in those people, and these people will get arthritis at an early stage like second decade or third decade with 20 to 30 years also. So that is a rheumatoid condition. So how you can delay the arthritis is the question. When you got arthritis, we'll say certain things do not be done. Like we have a habit of sitting on the floor or Indian toilets. After the pain started in the knee, we need to respect the body. We need to avoid these things. If you try to do like climbing stairs, sitting on the floor, you'll struggle to get up from the floor. That's where the lot of forces on the knee acts. So after certain stage, it is difficult for you to do that, then don't do it. If you are simple, I mean, you don't struggle to do that, getting up, climbing upstairs, you can do that. It's simple. If there is no pain, you can do it simply without much efforts, you can do it. But if you are using effort to or struggling to get sit on the floor or getting up the staircase, please avoid it. That can increase the arthritis at a faster rate. So that is precaution. So how to prevent it? Being an active lifestyle. Lifestyle is more important. Controlling the weight is the most common thing. When you control weight, when you reduce weight also, less burden on the knees will be there. So more flexibility in the knees. So load bearing also decreases. That's where you can prevent the arthritis. Lifestyle modifications like regular walking, and regular walking is more important. Doing strength training is also very good. Jogging after certain age, if there is no pain, no symptoms, you can do that. But all bodies are not same. Don't copy the others. Listen to your body, listen to your pain. Some people will already started arthritis. It is not advisable to do such type of jogging or running or jumping activities. You need to avoid, because the degeneration of cartilage is fastens the arthritis also. So in such type of activities because of impact. So you need to avoid certain activities after certain age or certain problem starts. So it is individual. It is not like everyone has to follow that. It depends upon your condition, your symptoms, your health status, and your flexibility is also more important. Diet wise, healthy diet is always good. Everyone requires what is rich, or everything is required in minimal quantities. That is more important. Some foods are rich with protein, some foods with fiber, some are antioxidants. You can't neglect one type of food and take everything more. So every type of food is important, but unless you have any other health issues, associated issues like diabetes or hypertension, you need to avoid certain foods like gout. You need to avoid certain foods. But unlike these people, if you don't have any conditions or suffering, healthy diet is always good. Don't indulge too much of protein, too much of carbohydrate. Everything is required in minimal quantities. Maintain your weight, walk properly, do regular exercises. That is the way to live longer, happier and healthier. Treatment of arthritis. So arthritis will go in stages. People will ask, what is my stage? More than stage, it's an X-ray reading. When compared to 1 year, second year, arthritis will go to next stage. That is involuntary. That's a process. So whether to treat what stage is not important. Whether you are suffering with arthritis, what is your incapabilities that you are not able to do that. That is more important. Initially arthritis starts while sitting and getting up or climbing on stairs. That slowly starts. People will think the knee will pain. No, initially the muscles will have pain, like the calf muscles or thigh muscles. And most people with this pain suffers when they go to bed. When they are in relaxed stage, they will feel more painful than on the walking stage. Most of the people, they will do the day-to-day work. So the symptoms will increase slowly. The walking will get worsened. They will change the gait. Most of the times, other people will point that you are limping. Rather than self-realization will happen after some more time. And people, they can't stand more than 15 to 20 minutes at the kitchen also. Most of the ladies will affected, then the gents, because of ladies will have the hormonal changes, post-menopause, and mostly these people are limited to the house. They won't expose much to the sun. The calcium is also low, so that's why the degeneration starts in the females first when compared to the males. There's a 10 years gap at least between the male and females. So so their capability, their day-to-day activities gets limited. That's where they have to decide. It is not the X-ray that gives the information. X-ray gives information how much is the amount. It's a planning thing. But what are your capabilities? If you are able to do your activities without any painkiller or occasional painkiller, that is good. You can run on, do the regular physio, do regular exercises, and walk. Don't stop walking. That is more important. People will think if I walk, the arthritis will increase. No, our life is for walking. If you don't walk, even if you keep ideal also, the arthritis will increase at a more proportion rate than people walk. So walking is more important exercise. People will get operated to walk. So life is for walking. If you don't walk, other systems will also fail, like heart and lungs also. The capabilities will decrease in that. You don't know that because you are limited to the householders. Once you go out with the pain, you can't able to do few more steps because of heart rate increases, and breathing capabilities also comes down. You'll have more asthmatic effect like this, palpitations, what we say, the heart rate increases. So such type of activities, breathing difficulties also will be there. Because you are indoor, you won't find it. When you go outdoor only, these things will happen. So when to operate, when to go for a surgery or not, that's a $1 million question. People will suffer for a lot, and they'll think after some time that will get cured with medicines or some injections. No, these medicines and injections can delay the things, but not the cure. There is no proper cure. Age itself is a cure. If you stop aging, the process will also stop. So when to get operated is your capabilities are getting limited, means that you are suffering with pain, you are not going out because of pain, and you are dependent on the tablets for pain relief, and your activities are almost becomes zero, then it is a time to go for surgery. If you delay the thing also, your age, you are losing the age also simultaneously, because people generally start from 50 to 60 most of the times. The females, this is the age group they will suffer. If you don't get operated, if you live for 5 years with pain and everything, not doing anything, you won't get back these years. If you walk healthy, you'll go up to 70. If you don't walk healthy, you can't go up to the 70. Think in a broader picture. People will think, if I get operated early, what will happen? If you don't get operated early, you won't live longer also, because of other diseases will catch up. You're not understanding your capabilities, and whatever the years you need to walk at a young age, you're not walking also. So you need to consult your orthopedicians when to get operated, whether it's suffering is there, will limit or halt, or this process will increase. That's more important judgment. So the big myth for most common people will address is, the pain is horrible after the surgery. The physiotherapy pain, I can't able to do it, I can't able to tolerate it. Yes, so many people will have that. There is some struggle with the physiotherapy, but the people who are doing exercises regularly before surgery also, they are very easygoing. And people who never do any exercise or any walking, they will suffer, because suddenly if you are giving exercise to the body, it is painful. It is like going for a gym. Suddenly if you start, the body has to adjust within 2 to 3 weeks. If you stop it, the pain will start. So physiotherapy pain is nothing but you are giving some struggle to your body to cope up the weak muscles. So that pain will be there. If you are strong enough, it will be tolerated. But you can't delay because thinking of the pain, because if you delay the process, the pain also will increase. Even now you are suffering with the pain. Physiotherapy pain will stay for 1 or 2 weeks because you are abusing your body with some exercises. That is not for every, that's not same for every patient. It will differ from patient to patient, their capabilities, their tolerance levels also. In the name of physiotherapy, you are delaying everything. Your muscles are much more weaker and your body organs are also deteriorating. So pain will be there. Now there are a lot of medications are there to reduce the pain, and surgery pain is nothing. If you are suffering for long, they will walk happily after the surgery, and this process is 2 to 3 weeks, depends upon the personalities. People who are active, they will walk, they will recover much more faster within 2 to 3 weeks, and people who suffer for long, their weak muscles, they tend to take a longer time, like more like 1 month to 6 weeks. So the pain is subjective term. It is not same for every patient. It is the fear factor. You need to get at some point. If you delay the thing, the pain will be more, because your body also has to cooperate for the exercise, surgery and exercise also. If you become too old, also the body won't cooperate. So arthritis cannot be preventable, can be delayed after certain stage. So how to prevent arthritis? Being active lifestyle, doing regular exercise, eating healthy, staying healthy, maintaining lifestyle is more important to prevent arthritis. So weight control is the main thing. Arthritis is inevitable after certain age. Don't worry about that. Then don't stop living in the fear of arthritis. And people who suffer arthritis, surgery is also a good option. If all other treatments are failed, you don't tend to delay, because other problems also manifest if you delay the surgery, because the age won't stop. The aging increases, the problems also will increase simultaneously. You won't enjoy the fruit of the surgery. Other problems also cannot be cured after certain age. Thank you.